So we went and did our own report. And we found, doing literature reviews from around the world, life expectancy 10 to 20 years less than average people, disproportionate rates of heart disease, cancer, diabetes, cerebral vascular disease, 30%, less than 30% of people with intellectual disabilities, as best we could determine, received care from a medical specialist. And we showed this report to then Surgeon General David Satcher. And he commissioned on the spot the first ever Surgeon General's report on the health status of people with intellectual disabilities. He published it on his last day in office, and this is what he wrote. As a society, this is the Surgeon General of the United States, not of Tanzania, where the health care is minimal. This is the United States. As a society, we have not been listening to or paying attention to people with intellectual disabilities. We have been too likely to expect others to speak to their needs. We have found it too easy to ignore even their most obvious and common health problems. Just as important, we have not found ways to empower them to improve and protect their own health. No one who cares would suggest that health care in the United States for this population is acceptable. No one would suggest that this is acceptable. A couple years later, the United Kingdom did a report similar. I can't hardly say the title without wincing. The title of their report, issued by their Office of Healthcare, Death by Indifference, chronicling massive numbers of lost lives due to the indifference of the healthcare system. And we looked at the two of them and we said to ourselves, why? First, let's be honest, people with intellectual disabilities are seen as a low priority. That's the truth. We ought to face it. Second, healthcare professionals report they don't know how to care for this population. Pediatricians do, in general. Everybody else will say, in wildly disproportionate numbers, they don't know how to care. And so they put up the walls. Third, money. You don't get the reimbursements. You don't get paid as much. Takes more time. People don't want to deal with that. Fourth, they don't understand the capacity of people with intellectual disabilities. Don't see them as people of value. Fifth, they don't see the needs. They don't understand the special health care needs of this population. And after all those things, you can say there's a less charitable view. And I heard it straight from one of our doctors. I said, how can this be? Where's the problem? He said, Tim, it's simple. He says, people come in to the doctor's office, and if they have an intellectual disability, they get a quick and dirty. Quick and dirty? Yeah, oh yeah. He says, you know, look, they're coming in for an eye exam. They're not operating a car. They're not operating heavy machinery. They're not a lawyer. They're not reading documents. You get them in, you check their eyes, you give them a pair of glasses, you get them out. Move them through. He closed by saying, I'm not proud of my profession, but that's the way it is, a quick and dirty. We saw an athlete just this past summer at the Healthy Athletes Screening Center in the United Kingdom. He'd seen a doctor 9 months before. He had an advanced, undiagnosed glaucoma that would have blinded him if the doctor there at the Special Olympics tent hadn't taken the time to really give him a thorough exam. So he had seen a doctor, and the doctor had given him, in effect, the best we can say is a quick and dirty. So how is this possible? Haven't we changed this? Isn't that over? Didn't we close institutions? Didn't we move people into community living? Didn't we open schools? Didn't we open opportunities to people in employment? Well, apparently not. Apparently not. So I would want us to say that we're in the midst of a human rights, a civil rights struggle for health care for people with developmental disabilities. It's nothing less than that. It's not going to happen if we continue to treat it as though it were just a simple, small problem, just the problem of one family, just the problem of one syndrome, just the problem of one diagnosis. We have a civil rights problem. And when we face it that way, and it's not about them, as every civil rights struggle is not about somebody else. Civil rights struggle of African Americans was not about African American people, it was about the country. Civil rights struggle of women or other groups wasn't about women, or isn't about women. These things are not over, by the way. It's about all of us. It's about what we need to do as communities, as cultures, as systems of caregivers. So this struggle is also about all of us. It's not about Billy Quick. It's not about Jennifer. It's about me. It's about what I'm doing You can't have discrimination and exclusion if somebody's not doing the discriminating and the excluding. So we have to recognize that we have to rethink the potential of every person. We have to remember the lesson I believe my mother learned many decades ago from her sister. Dignity is not an achievement. Dignity is not something you earn. Dignity is what you start with. The quality of access to quality care is something everybody gets at the beginning, not as a function of what they earn. It's not something their accountant gives them. You don't get your health care. You don't get your value as a human being from your balance sheet, from your checkbook. Special Olympics as a movement is committed to giving everybody the chance to be a great athlete, but you can't be a great athlete if you're not a healthy athlete. So we're willing to join the fight. We're willing to provide a platform. We're willing to do what we do best, I believe. But we shouldn't be fighting the healthcare system. We shouldn't be fighting healthcare providers, in my view. We should be a catalyst. And that's why when you come to Special Olympics events now, when you come to Keith's events here in the state of North Carolina, which, by the way, 38,000 athletes are participating in the state of North Carolina in Special Olympics programs at the community level. But if you come, you'll find all 8 state events like, for instance, this weekend's upcoming fall games, will have a healthy athletes screening center at the games. Why? Right at the games, bring the doctors, bring the healthcare practitioners, train them. They say they don't know, they haven't gotten training, we'll train them. They say they don't have any exposure to the population, we'll give them exposure. We'll introduce them to Marty, we'll introduce them to Billy, we'll introduce them to Jennifer, we'll introduce them to all these people who they're afraid of. We'll show them right there on the spot what they can do to do an oral health exam, to check the eyes, to do a fitness examination, to do a body mass index test, to give someone training in stretching and physical therapy, to identify problems of podiatry and other kinds of things. We don't have emergency rooms. We don't dispense drugs. We're not a healthcare, but we're a catalyst. Why? Because when you come to these events, my hope is, at least, every time you come, you sit in the stands just like this, and you got a track behind me, and you've got athletes lining up down at one end, 6 or 8 athletes, and everybody in the stands watches, and you hear the gun go off, bam, down the track they come. And you know, everybody knows. It's a tough day when they were born, hard to get into school, challenge from mom and dad every day, often excluded by peers, not on the track. Down the track they go. Bam, at the end of the line. Okay, I count, right? I belong. I ran that race. I came in second, and I did well. Moms are proud, just as proud as any mom could ever be. Dads are proud. The catalytic moment is when the people in the stands, just like us, say, oh, I get it. Real person. Deserves real care. Let me go back to my tent. Let me go back to giving care in that tent, and let me change my practice. Let me make sure my office is open. Let me make sure I am a person who makes care available. Let me make sure that my medical school improves the training. Let me make sure that I advocate in my community for changes in reimbursement policies and those kinds of things. Why? Because look at that guy. Look at him run that race. How dare we as a society tell them they're lesser or deserve less? So our hope is to continue to expand these health programs, to do it all over the world. Already we've done almost 1 million health screenings as part of the Special Olympics movement around the world, but we want to do more. We do fund fitness, we do health promotion, we do physicals, we call it through MedFest, we do hearing exams, we provide hearing aids, 70,000 pair of glasses we've fitted athletes for around the world. We have wonderful stories. The athlete in the Philippines got his glasses, said, oh, Mom, I can see you. Mom, you're beautiful. The doctor was never the same. Or the 3 athletes in Nigeria who were seen at the national games that had glaucoma. And the volunteers there who said, I know a doctor who will provide the care. The doctor said, we can do it, but we can't do it for less than $500. The volunteers gave the money, saved the eyesight of 3 athletes on the spot in Nigeria. People of goodwill who get it and say, I'm not going to allow it any longer. even if it means going into my own pocket. The dentist in Lebanon who told me now 60% after being exposed to this movement, 60% of his patients were special needs patients in Beirut. He says, I've got the entire population of people with intellectual disabilities of Beirut coming to my practice. He said, none of them pay. He says, I've lost 60% of my income and I've never been happier. Shouldn't have to be that way. Shouldn't have to be that way.